Hey guys, this is Dr. Ip at Vibrant Dermatology. Today, I want to talk about melasma. So, even though Mother Nature is confused, summer is upon us. And for my patients that struggle with melasma, they have to work really hard to make sure that they don't have that stubborn hyperpigmentation on the face. So, what is melasma? Melasma is patches of hyperpigmentation that can appear on the face, and it's heavily stimulated by the sun, and it's heavily stimulated by estrogen. And that's the reason why that we see melasma more commonly in women. We can see melasma popping up during pregnancy, or if you're using oral contraceptives, which increase the amount of estrogen you have in your body. And so melasma can be very challenging. And one of the things that I tell my patients with melasma is that particularly in the summer months, you have to work really hard to not have your melasma flare up and get worse. So what we're doing today is microneedling. And microneedling works for melasma in a couple of ways. First, when we're putting these tiny needles in the skin, we're making a tiny microscopic injury that allows some of the pigment to actually extrude from the skin. And then the other thing that we're going to do is that after I finish needling her skin, I'm going to add a medication to it called Tranexamic Acid. Tranexamic Acid is a newer medication that we use for melasma. It actually is usually used to stop bleeding, and it can be used for heavy periods. And now what we're doing is using tranexamic acid topically in certain skincare preparations, and also in this instance intradermally to address the hyperpigmentation in the skin. So I'm just finishing up the needling part of this, and then I'm going to apply the tranexamic acid to her skin. In addition to the tranexamic acid that we're using intradermally today, she's also taking oral tranexamic acid. So after I finish needling the skin, you can see a little bit of pink, which is pinpoint bleeding, which tells us that we've gotten down to the dermis, which is where we want the medication to be. I'm gonna clean that off. And then I'm going to switch to the tranexamic acid. So the first thing I do is I'm gonna just pour some of this medication onto the skin, okay? Pour that on, and I'm rubbing it into the areas where she has the melasma. And then the next thing I'm gonna do is actually inject some of this intradermally, like under her skin. And I will admit that hurts a little bit, but there are studies that have shown that injecting the tranexamic acid under the skin actually improves the efficacy of the medication. So I'm pouring it on everywhere here first, and now I'm going to take this giant needle off, and I'm going to switch it for a tiny gauge needle, 30 gauge needle, and I'm going to inject it into the areas where the melasma is more prevalent. So we're going to just do some tiny dermal blebs here under the skin. If you ask if it hurts, yes, it hurts. She's just being super stoic for the video, but it hurts a bit, I'm not gonna lie. You see, I'm just kind of putting that under the skin where she has it. And then I'm gonna go this side here and do the same thing. And I'm really targeting those areas where the melasma is thicker. So while I'm doing this, we can talk about other things we do for melasma. Other treatments that you can do for melasma include chemical peels. We can do certain lasers. Not all lasers can be used for melasma. Some lasers actually make it worse. And that's why it's important to be under the care of a board-certified dermatologist. We also have tons of topicals that we use for melasma. In Massachusetts, I like to cycle my patients on and off of hydroquinone depending on what's happening with the weather. So now that we're done with this part of the treatment, what I'm going to do is just rub that in, and we're going to put on a mask, which is a hydrogel mask that allows the medication to be absorbed under her skin. So if you have melasma, it's really important to find a dermatologist that you like and to make sure that you're on routines that are helping to address your melasma all year round. If you have any questions about melasma and treatments for melasma, you can feel free to comment below.